Also this week, Senate Republicans introduced a new version of their health care bill. It contains concessions to both conservative and moderate members of the party, but its chances for passage are still unclear. Dr. Telenko, how do you view that there are enough concessions in this bill that the Democrats will now be happy when we can move forward?
The Democrats are not happy. I don't think they'll get any Democratic votes, but I think they now have enough Republican votes to pass it next week. They'll be able to debate it and pass it next week, and that's due to a number of concessions they've made to get some of the more conservative Republicans on board, as well as some of the more moderate Republicans. Some of those concessions include offering more bare bones insurance plans, and that makes the conservatives happy. The problem with these plans is it really gives the appearance of insurance coverage without actual protection. They rarely cover preventive care, which is the most cost-effective type of care, and often they don't have enough catastrophic care to really prevent these catastrophic bills. We need to remember that illness and medical bills are the #1 cause of bankruptcy in the U.S. and, in fact, the world. Some of the other concessions is this $43 billion for opiate addiction, to treat that addiction. And there I think we also need to remember that the opiate crisis was actually caused by cost-cutting measures. Back pain and other orthopedic pain used to be managed through physical therapy. This was more expensive in the short run, but actually cheaper in the long run. You had better outcomes, people were more likely to return to work. When you switch to sort of the faster idea of giving people pain medicines, getting them back more quickly, more of them became addicted, and actually more opioids got out in the community and ensnared non-patients. And so it's interesting to see that we're trying to address this crisis now. Another change that was made is 2 of the taxes that were in the Affordable Care Act are now being preserved. In the original version of the bill, they were cut.
All right. Leif, how would you like?
I think you're right on some of the catastrophic health care plans. Now, younger people will find those more appealing to them as a cheaper rate because a lot of times they think they're invulnerable.
It's better than nothing.
But it is good for older people too who don't want to have maternity coverage pay for or have to pay for it. If I'm 65, I think my children days are over. Although with medical advances, we may be looking at that as a different thing later.
No.